All right, we are live now with Dr. Raynard Washington, who I kind of grew up with, and we both grew up in Richmond. Both went to Moody Middle School and Henrico High School together. And Dr. Washington, it's been a long time since then.
Yes.
But thank you for joining us tonight. We appreciate it. Dr. Washington is an epidemiologist working as a deputy health director in Mecklenburg County, which you might know better as Charlotte, North Carolina. So first, I wanted to say congratulations on your career.
Thanks.
From what I remember in high school, I don't remember you being particularly interested in epidemiology. That might have been too soon for you to have discovered that calling.
Yes.
I mostly remember you being somebody that every teacher loved.
Yeah.
And I remember you and Ebony Hill being close and being up to date on all of the gossip.
That sounds about right.
So, and you don't have to mention anything about what you remember about me. We can just steer past that entirely.
I'll spare your congregation.
So I wonder if you can just introduce yourself a little bit more and talk about kind of how you got into the field of epidemiology.
Yeah, sure. So yeah, when I graduated high school, I thought I wanted to be an emergency medicine physician. So I left Richmond and went to the University of Pittsburgh, and I majored in biology and chemistry, as most pre-med students do, and I sort of trucked my way through college and did a lot of fun stuff, did a lot of hard work. And then in between my junior and senior year, I went to a very small area, well, a large geographic area, but a very under-resourced region in like the northwestern part of Tanzania. It's an area called Karagwe, and I lived there for about 2 months at a charity hospital. And while I was there, they were in the middle of a malaria outbreak. And I was living at the hospital, and this area was really very under-resourced. They were completely void of a public health system. And this hospital was basically servicing like 400,000 people with just 2 doctors. And for me, it was a chance to kind of see like what happens when the healthcare system is solely just healthcare, and also to live in the middle of an epidemic that was very apparent. There were a lot of sick people. The hospital was quickly overrun. They basically set up these large tents in the sort of courtyard of the hospital, and they put these foam mattresses down for families to come, and people would come to the hospital. They traveled days to get there. And so it was a middle of an epidemic of a malaria outbreak there. And for me, it's kind of weird now that I'm talking about this, given all that's happened in the last several months in the country and the world with the COVID-19 pandemic. But anyway, I got to see public health being absent in a space. And so for me, I got more interested in looking into epidemics and pandemics and how they are monitored and controlled. And then I got back to Pitt for my senior year and took a class in epidemiology or public health, and was like, wow, this is pretty cool. So I decided to go to graduate school and get a master's in public health. And after my first semester in the master's program, I decided that epidemiology was the path for me. It was like a light bulb went off. It was like healthcare, it was science, it was math, it was sort of all wrapped into one. And so I was like, this is perfect. So then I decided to get a PhD in epidemiology after my first semester of graduate school. So then I just basically stayed in school from the time that we started middle school till I was 26, and I graduated, and I've not looked back since. So yeah, that's how I got into epi, and it's been quite the ride.
Yeah, and that's amazing. That's just a remarkable path. And then you just, right before we went live, you told me about how you landed in the position where you are now and when you landed in the position. Can you share that again? Because that's also insane.
Sure, yeah. So first off, I'm incredibly blessed. I've had a chance in my career so far to really be extended some incredible opportunities. So I consider that a true blessing. I am currently the Deputy Health Director for Mecklenburg County, which is a pretty large county. We have about 1.12 million residents. The largest city in Mecklenburg County is Charlotte, which is about 800,000 people. And I started work on March the 16th of this year. Before that, I was in Philadelphia. I worked for the health department in Philadelphia, the city of Philadelphia, which Philly is a city and a county. But so yeah, when I got to Mecklenburg, we had 8 cases of COVID-19. And as of just a little bit ago, we have almost 8,000 today. So it's been quite the 3 months here in Charlotte. I've pretty much been working nonstop since I got here.
Yeah, you must have had to hit the ground running and haven't really stopped. And I noted also that you were in your office, and you said that that's pretty normal to be in your office at this hour.
Yeah, we work pretty long days right now. We've been able to sort of relax a little bit, but the days are pretty long. And when I got here, my first day of work, I went to orientation for 2 hours, and I left orientation early, and I rushed off to the Emergency Operations Center, which is sort of the hub for the pandemic response here locally. Well, it's one of the hubs. So it's the emergency management hub. And then we have a hub here in the public health department. So yeah, and it's been just nonstop since I got here.
Wow. So how are you holding up?
I'm good. So, I pretty much just work and eat and sleep. I've probably gained 10 pounds since I've been here because there's like not a ton of time to do too much else. I'm excited to be officially moving this weekend to an apartment. So I've been living in a temporary place since I got here. So,
Man, well, on behalf of the folks that you've been serving, thank you for your service and dedication and sacrifice in the midst of all this.
Yeah, it's great. I'll tell you, it's really interesting. We spend a lot of time in our academic training preparing for things like this in a very theoretical way. So it's very interesting to sort of be in the middle of it. And it's unfortunate. It's an incredibly unfortunate situation. But I think as an epidemiologist, it's certainly this is what we trained for. So it's like soldiers being called into like a war. So that level of pride and investment, we are committed to the work and realize that there's a lot happening that most people will probably never see or never be aware of. But we got a whole workforce of folks. Here in the health department, we have I have like a team of 850 people working on various aspects. Some working on COVID response. Some working to just keep up the usual public health things, because just because COVID-19 is here doesn't mean that everything else goes away. So we have a whole team of nurses and doctors and community health workers, case managers, all of whom have had to adapt how we deliver services and how we protect the public in this environment. So it's been quite the ride.
Yeah. So what are some of the things that people might not know that are going into your work that like behind the scenes? Now that you mentioned that, my interest is piqued.
Yeah, so I mean, I think some things people are aware of. I think the things that people hear a lot about are, of course, we have a staff of folks who are case investigators. So whenever a person is diagnosed with COVID-19, we get an automatic report from either the laboratory or the provider. And so every single person that gets diagnosed, we get their information and we call them and we launch a case investigation. And the point of that really is to figure out, one, to make sure the person's okay, but two, it's really to understand who that person may have come into contact with while they were infectious. So we have a team of investigators who call them and reach out to them. I mean, you probably have, this is very similar. This is a traditional public health practice. And so for other infectious illnesses, we do the same thing. So like STDs, we do the same thing where we try to figure out who that person may have come in contact with. We call them and then we try to figure out who they came in contact with. And then we try to call all those people to alert them that they were potentially infected. So that's a whole process. Those individuals have to call them, they have to try to reach them, they have to find out if they went to work, they have to find out if they went to any kind of gatherings of those kinds. And so there's a whole team of people that are doing the whole case investigation and contact tracing process, which is a process. You think about it, I think we had about 270 cases. So we have to call them almost immediately in real time to get in touch with them. So they, one, know that they're infectious, and two, we can figure out who they may have infected and get in touch with those folks. And with the respiratory illness like coronavirus, it's essentially so infectious that we really have to work sort of urgently. So we pretty much work 7 days a week, a number of hours a day to be able to do that in real time. We also have other interesting things. We're running a hotel, which is not traditionally what we do, but we have a hotel, isolation and quarantine hotel. So for individuals who are infected with the virus and aren't able to isolate themselves at home, so either they live with a large family who's not infected, or they are homeless or living homeless, or if they're living in a congregate living setting like a shelter or a college dorm, then we have this hotel that our staff are running to basically give these folks a space to isolate and quarantine. And so a bunch of public health people who have never run a hotel before are running a hotel that we leased from a company. And that's a whole process. Those people have to stay in the hotel. So we have to bring them food, we have to bring them medicine, we have to have nurses on staff to be able to provide care for them. It's an entire operation. So there's a whole host of detail that again, we only had a short period of time to be able to stand that hotel up, sign a lease, create staffing, and create processes and protocols to make that happen. So lots of effort. We're also planning a test. We have testing drives, which is a whole process in and of itself. I don't know, you probably have seen drive-through testing sites in Manassas and other parts of Virginia. That's a whole operation. Trying to coordinate 1,000 cars driving through a parking lot in a day is very difficult, especially when you have to, get people's information. You have to have stations. People are impatient, and of course, people don't feel well. So there's a whole host of challenges that can come along with that. So, and then also, I spend a lot of my time talking to organizations who provide care to people and services to people, and businesses and organizations who are either looking to reopen or looking to just be prepared and adequately respond. Earlier today, I had a call with about 85 churches to talk their pastors through what reopening should look like, what it could look like, sort of the step-by-step, what guidelines are recommended, and answer their questions about it. After that, I had a call with a bunch of HR people from a bunch of businesses to talk to them about how they handle when they have a case in their organization. And these are all details that people don't often think of, especially folks who are working at home right now. But there's a lot of planning that goes into making it safe for people to re-engage and to get back into the world.
Take a breath, man. That's so much. I can't.
It's fun though, right?
Yeah, wow. Thank you again. Do you want to give me the Cliff Notes version of the talk you had with clergy today?
For sure. Number one is keep offering virtual services.
Yeah. Okay.
We don't want people to feel the rush to be back into gatherings. Mass gatherings inside are basically they are breeding ground for a virus like COVID-19, because individuals are going to be in a close contacts for long periods of time. And so really any kind of indoor gatherings are really highly discouraged at this time. In our state, in North Carolina, they are permitted by law. So they're not subject to the gathering restrictions. But as I encourage them all, keep online offerings. And then those folks who are most vulnerable, who have health conditions, who are older, should be encouraged to stay at home and participate virtually. And then there are a whole host of things around, just social distancing, physical distancing in the church, no choirs, and people should wear masks, and you should not ask the audience to yell back at you, amen, too much.
Yeah, well, my congregation doesn't do very much of that now, but there are a few, and I'm hoping they'll start once it's safe to do so.
Yes.
I'm guessing once it's safe to do so, everybody's going to want to be shouting and singing in church.
I'm sure, very sure.
It's going to be a while. And I don't know if you're a member of a particular faith community. I'm just curious if you were or are. When do you think you'll go back? Or when
church? This funny. There was a New York Times article that came out about 2 weeks ago that did a survey of us epidemiologists, asking when we would feel comfortable doing a lot of different things. And for me, the church, a mass gathering, I would not feel comfortable probably at least until the flu season's over.
Okay.
So that
So
will be sometime next February.
yeah, so that's sobering, but I think it's the kind of thing that we need to hear. I'm
Yeah.
curious about this talk about a second wave, and how guaranteed that is, or anticipated that it is, or what.
Yeah, so my personal belief, and I believe this has been said. I said this last week before Dr. Fauci said it. We're not done with the first wave.
Yeah.
So what happens when you put into effect interventions like a stay-at-home order is essentially you hit the pause button on the pandemic. So stay-at-home allows us to basically drastically slow things down, while we in public health and the healthcare system really works to prepare ourselves for it, and allows us to get supplies, allows us to build field hospitals if we need to. It allows us to stop doing elective surgeries to keep people out of the hospital, implement rules, and it gives us time. And basically, it's an effort to buy us time, but it doesn't stop the virus. It doesn't get rid of it. So COVID-19 is still with us. It's still spreading, freely spreading in our communities. And so now that we have lifted stay-at-home orders, or are starting to lift them, we basically are hitting the play button now. And so the show's back on, and essentially the goal is to put the show in slow motion so that we don't go too quickly. So things don't start to accelerate too rapidly. And that's why it's critically important for folks to remember and realize, despite the fact that we're all getting fatigued with being at home, we're all getting tired of people telling us to wash our hands and to keep our distance, and we all want to get back to things as they were. The reality is the virus is still here and it's still spreading. And for some people, the risk of severe illness is pretty low, but for a lot of people, it's still pretty high, and people a lot of people are really vulnerable to the illness. And then it's a tricky virus. Some people respond very differently. We have a very young person here, less than 13 years old, on a ventilator. The young person doesn't have any health conditions, underlying health conditions. They're just a kid, but their immune system overreacted to the virus, and so that created the need for them to be on a respirator. And so I think as we think about sort of our decision making as a people, we have to just be cautious that there are risks associated for others, and we have to respond as a community.
Yeah. Thank you. That's really informative and helpful. And there are churches like ours included that are having those conversations, and that kind of input is really helpful to us too. Our church council is meeting on Sunday, and so I'm glad that we're having this conversation. Thank you again.
Yeah, sure.
So our church actually got to serve as a testing site for one day, which we were happy to do. And they offered 300 tests in the community, which was good. A few days after that, then there were some protests after the death of George Floyd and Breonna Taylor. And I ended up getting invited and went. And so I actually went and got tested myself after that. And my test was negative. And then I went to a couple more protests and haven't been tested since then. But I'm feeling okay right now, and I'm just still being cautious.
You should still wear a mask when you're around other people.
I did wear a mask the whole time. My wife is a medical professional in public health, and she was really worried and then angry with me when she saw me touch my face in a video while I was at the protest. So she's on. What I wanted to hear from you, though, is what was it like for you as an epidemiologist to see all these folks out protesting in mass gatherings with a variety of levels of PPE?
It's really tough, right? As a Black man, I am incredibly proud of people standing up for what they believe in and standing up for what I believe is right. And I think that in the history of this country and in our history as a people, it's always been important for us to stand up and represent and make our voices heard when folks try to keep us quiet. So for that reason, and the injustices that we observed in many of those cases, not just George Floyd's, I fully support people doing just that, right? So that's one side of me that is that is incredibly proud of us as a people and a community, not just Black people, but all those who are standing up for what's right. On the other end, we are in the middle of a pandemic, and it's a respiratory virus. And so I have continued to encourage people to stand up and to protest and to rally, but do so in a safe way. And that includes wearing a mask while you're in a protest or any kind of event. Keeping your distance as best possible, which I know is often difficult, and then just trying to be smart and in terms of how you position yourself around other people. So I think we believe and know that there will be some additional spread of infection due to these gatherings, which are essentially mass gatherings. I'm thankful that they're outside, because that does significantly reduce the risk of spread when you're outside, because you're in open air. So, I encourage folks to continue to stand up for what's right, but at the same time, do so in a safe way. So wearing a mask, taking hand sanitizer with you, putting that in your pocket, washing your hands, not touching people, not touching surfaces, but and peacefully sort of standing up for what we believe is correct. So, I think we're keeping a close eye. We were really on top of encouraging protesters and folks who are participating in rallies and events of that nature to get tested. To monitor their symptoms. That's really, really important, so that they are not spreading the infection further if they get it. And then, of course, to wear a mask and 14 days after you leave, after your last participation, and to get tested again after your last rally to make sure that you don't have the virus. So it's a little stressful on the as an epidemiologist, but I think as that's where me as a person, a Black man, I feel proud really to see people taking action against inappropriate action.
Yeah, thank you. I myself have been a little bit curious about whether we've been. Well, I just know in our church and in my own life, I think I've been more attentive in this particular episode of police brutality and the reminder of systemic racism. I've been attentive in general, in part because I went to a high school that wasn't all white. It was, I went to a middle school and high school that were predominantly Black, and so I think I had access to Black spaces earlier than a lot of my other white neighbors. So I've kind of been blessed with that awareness, but this time around seems different. And I guess I'm curious if the fact that we're in this social distancing time with a lot of other things canceled is a part of that, or if we have a longer attention span to it because we're kind of stuck indoors. Do you see any intersection there?
I don't actually. I think what's really happening is that that this keeps happening, and at some point, it's just like anything that gets battered, beaten, and bruised. It can only take so much. You can only break an arm so many times before the arm falls off, or the arm no longer works. You can only crash a car so many times before it's totaled. And so I think people are just, I think we have for a very long time, by virtue of what's been happening in this country, not just this last few months, but even over the last few years in politics and community, I think people are just tired, and now feels like a good time for people to really to take a stand and say essentially enough is enough. I mean, at some point this has to stop, and if it doesn't, then we won't stop. So I think it's interesting. I don't know. I don't know. I think it's very hard. We had a Board of County Commissioners meeting on this past Tuesday. And I admittedly have not watched the full video of George Floyd's murder. It's quite frankly too graphic for me to sit through. But at the board meeting, we did a moment of silence for the 8 minutes and 46 seconds. That's a long time. And we sat there in silence and for 8 minutes and 46 seconds. And if you sit there and we don't do much for it. We don't sit still for that long except when we're sleeping. But to sit there for that long and imagine someone having, not yelling for their life, essentially, I think that level of graphic nature takes people to a very, very tough place. And so I think that that really was a tipping point for a lot of people. That level of brutality, I think, is beyond what many people can stomach. And so I think, unfortunately, it happened. And God knows his life is worth so much more than a protest or a rally. But the reality is, hopefully, his death will not be in vain.
Thank you. I wonder if you can speak to the fact that what we're seeing is that this virus is also disproportionately harming poor folks, and in the U.S. that correlates highly with people of color.
Yeah.
And how's that happening, and how does it make you feel?
Yeah, so I've said since early on in the days that it's not a matter of our race making people more susceptible to the virus. It really is more a number of things. The first one of those is there's a real difference in underlying sort of well-being and health overall. And this particular virus, for folks who have chronic illnesses, and it can be as simple as having asthma or being overweight, it certainly makes you more susceptible to severe illness as a result of the virus. And so we see higher rates of those conditions in communities of color already. And so essentially, when you add a respiratory illness on top of that, you essentially start to see more people are more susceptible. And early on, we didn't have a lot of tests. And so we weren't testing a lot of people. And so you had to be pretty sick to get a test. And so the sickest of people were getting tested, and those sick people just happened to be the people who had the most underlying chronic illness, and they happen to be in many ways more poor people and more people of color. So there really was an underlying driving factor. People of color are also overrepresented in the essential workforce, and not just in healthcare, but in critical infrastructure like grocery stores and construction workers and the folks who work at convenience stores, the places that were still open while we were shut down. And so that puts them at risk every single day at work. And then they go home from work and they have loved ones that they live with, and they go back to their communities. And so those individuals are less likely to be able to not work. And so it's harder to say, I can't go to work if I have a child that I have to be responsible for and have to feed. And so, we really worked hard to make sure we were getting the message out, and that testing was available and resources and supports were there for people who had to quarantine. So we have a number of people who have been supporting families who have been in this situation where they can't work. And providing resources for them. But certainly those factors really have been driving up inequities. And then that just translates right into the deaths. So you have more people that are sicker, the more people that are of color who are getting the virus. And then that just increases the number of people of color who may potentially die from the virus. We are in Mecklenburg County starting to see some balancing of the disparities in deaths, but that's really driven by the fact that we have a number of outbreaks in long-term care facilities like nursing homes, which are more likely to have more white people than they are people of color. And so it's sort of, you're not really seeing that community disparity. So we have to really use data to parse it out so we can understand, really what's going on and have a complete picture, which is what we do as epidemiologists.
Wow. Every time you talk, I just, you don't breathe a lot, and you just keep sharing so much information, important information.
I talk all day, so I'm probably.
Well, yeah, and I know you probably have said all of this stuff to 18 other groups today.
Yeah.
I'm just really glad that we got to be 19, because I think it's really helpful to hear information from somebody as knowledgeable as you. I wonder if you've, so in a lot of different ways, people like me and people of faith and goodwill are asking, what can we do? And it's not always, it's not, particularly when that's a question about racism, it's not always a fair question. And I get that, but particularly around the pandemic, I'm curious if you got thoughts about what we can do to do our part from wherever we are.
Yeah. So I think the first thing I'll say is, we have some really important messages that we have to get out to people. And we have to be, as faith leaders, you are really a trusted messenger for your community, the community that you serve, your congregation as well. And there's so much information with social media and with TV and with media and with every way that we can access information today that can be misleading, be inaccurate, be manipulative in some ways. And so I think having trusted voices with the right information that's accurate and timely is incredibly important. Because people are scared, people are frightened, people are anxious and sad, depressed, lonely, and a whole host of things. And so I think having accurate information about what's going on and what people can do to protect themselves is really important. So and keeping yourself informed and keeping yourself plugged into the public health experts in your community to say, what is it I'm supposed to tell the people, right? The people will listen to me, so what should I be saying is really, really important. And what you should be saying, especially, is wear a mask, keep 6 feet, and practice good hygiene. So that's really important. So that's one really, really, really good thing you can do. And then the second thing is to take care of those among us that are most vulnerable. So there are older people who are at home, stuck at home, unable to come out. Any kind of service that we can provide for those individuals, and even younger people who might be immunocompromised or who might have underlying chronic illnesses, providing services, helping your neighbor, encouraging people to help their neighbors, to be able to get food and other services, their medicines. Those little small gestures and deeds are really what I think builds community in these kinds of tumultuous times that we're living in, and really, establishes or reestablishes faith in humanity. And so I think to the extent that you can organize people to support those kinds of efforts, making testing available at your church is really important. And then again, just prioritizing the people over the business of the church. I mean, I think, I told the pastors earlier today, I know that the church is as an organization, and there's a lot of responsibility that you have, and a lot of charity and goodwill that's done, and then you have to operate as well. But really being able to sort of think about the people and do whatever you can to make sure you support those who can't support themselves.
Thank you. I really appreciate those messages, and I will take them to heart and make sure that our church council hears them too, and that will really help us make the decisions that we have to make in the coming weeks and months. I really appreciate it.
Yep.
I wonder, folks who are commenting on Facebook are sharing their thanks for the great information that you're sharing. So
sure.
A lot of gratitude for your generosity. I wonder how we can be praying for you and other folks that are in similar positions.
Yeah, I think just pray for strength and physical strength and peace and those things. A lot of public health experts have been incredibly criticized during this entire process. There was an article, I don't know, like last week, about how many health officials have been forced to resign or quit or have received death threats, all in the good faith of trying to help people and to protect the public health. Public health doesn't always get a lot of attention. So most people don't know what epidemiologists are until now. And so, we work hard all the time to address not just COVID-19 and infectious illnesses, but every other inequity you can imagine, and every other issue that impacts health negatively, we're working on actively, including racism. So I think just pray for guidance and peace. This is uncharted territory for us as a country in modern history. And so just having the right direction and staying focused and not allowing political pressure or the pressure of the media to influence our integrity, it's tough. I mean, it gets really tough because there are a lot of forces at play, especially when you start talking about people's economy and money and things of that nature.
Yeah.
So I think, having the good faith and the resilience to withstand all of that is really important. So, and then just pray we all get a vacation at some point.
Yeah. Yeah. If I could snap my fingers and give you one right now,
Yeah.
I would.
Yes. Yeah.
So, but you just mentioned one thing that reminded me of something I wanted to ask you about, because I just saw it come, I think, from your Facebook page about a new public health crisis that was kind of made official in Mecklenburg County, that's something related to race that was declared a public health issue.
Yeah.
Can you tell us that story?
So our Board of County Commissioners passed a proclamation on Tuesday declaring racism as a public health crisis in Mecklenburg County, but also in the country. And it's not new news, and it's because of the protests. It's not because of the unrest. We have long that's what we do in public health, right? We try to figure out what are the things in our society, what are the systemic things that are causing people to not be healthy or making it difficult for people to be healthy. And it's been well recognized that racism is one of those things. Racism in our institutions like the healthcare system, racism in the political system, the criminal justice system, all of those feed into inequities that we as people of color experience. And so what the proclamation essentially does is it establishes racism as a problem, and really opens the door for not just conversation, but opens the door for investment and addressing it as a problem. If you don't have things listed or defined as issues, if you don't call them what they are, then in fact, people don't make investments that way. And so I think while the proclamation itself is essentially symbolic, what it does legally is give the Board of County Commissioners the pathway to be able to establish both action and resources and investment in addressing racism as a problem. So a number of jurisdictions across the country have done it, and we're excited to be a part of that cohort of folks who've done so.
So we in our church and folks that are listening too, I know are in positions of power in local government and beyond. And I'm curious if you can put on your lobbying hat now. Talk a little bit about what kind of policy changes or funding changes do you think could happen that could make a difference in public health in general, or with racism as a public health issue?
Yeah, so the first of these is investments in and I don't want to call it research because that seems really academic. But it's really investing in understanding and quantifying and measuring racism, which has been a huge challenge for everyone because studies on racism are not well funded. But our ability to be able to identify where racism is occurring, our ability to be able to rectify it, our ability to be able to enforce policies that make it illegal, that make it come with a penalty, as opposed to just saying, okay, a doctor discriminated against a person and that, something happened, but, actually making it a penalty. And then also investing in, not taking for granted that everybody understands when their implicit biases are at play and they are discriminating against a person because of their race, and they may or may not know it. So making sure people go through adequate training to understand and go through not just, your traditional boring training, but actually going through a process where people can become more self-aware about color, more self-aware about privilege, more self-aware about what that means and how they might have it and not know it. And so really, and that's not just in healthcare, but that's across all systems, being able to do so. And then pointing to structural factors. So in neighborhoods that have a lot of minorities, actually addressing those inequalities that are structural, for example, grocery stores or recreational spaces where kids can play, or investing in things that make living a healthy life easy, because that's really the goal, right? Like, the problem, if you go to a neighborhood that's full of corner stores that all they sell is junk food, you have more gas stations and check cashing places and fast food restaurants, and you want to know why people are obese, right? Like, that's the options that are presented to them, not just in their neighborhood, but within a 5-mile radius. And so I think, that structural racism is incredibly powerful and often discounted and not observed. And so I think to the extent that we can to pass policies to do those kinds of things are really important, and just make investments, right? We spend a lot of money on a lot of things in government and in industry, but if we are able to create systems that can channel some of those funds into closing the gap, it would be incredible.
Awesome. That's hugely informative and helpful. And I think for the folks that are listening, I'm sure they're with me in being really grateful for your generosity of your time and your expertise. I want to invite folks who are listening who found this helpful to share it, so that the really excellent information that Dr. Washington shared with us, and really his heart for people and for public health can get shared broadly, so that we can all experience that and our friends can experience it too. I want to ask if you will please pray for us in the coming days too, for the clergy that you talk to, for me too,
Sure.
and for our church, particularly as we start to think about race differently than we had before. No matter kind of where you're starting, this is a new day, there are going to be new conversations. So as our hearts are being renewed and shaped and changed, and our minds are being renewed and shaped, changed, pray for us. And I promise that we will pray for you.
Yeah, I really appreciate it.
Yeah, we'll mention you by name in worship on Sunday, and yeah, I'm just really grateful.
Thanks for having me. I appreciate it. I'm glad we were able to find a time that worked.
Yeah. Because I first asked you about this in like week 2 or 3, and
yes,
that was too big of an ask. So I'm glad. Thank you for your patience with us and your generosity, and as our principals, multiple principals said at Henrico High School in the early 2000s, they would say, "Behold the green,
and gold."
So to the world, just feeling very impressed and proud of my classmates. I say, "Behold the green and gold. Behold somebody who has really found a calling and pursued it, and has given himself to be educated for the sake of others." So I thank God for you and for your time tonight. Thank you.
Well, thanks, Drew. That's a real honor, and I appreciate that.
Yeah. I'll talk to you again soon.
All right, talk to you guys soon. Take care.
If you get to Virginia or Richmond or Northern Virginia or anything like that, drinks are on me. Okay.
All right, cool. Sounds good.
Okay. Thanks. Bye-bye.